I'm Dr. Richard Stevenson. I'm a cardiovascular surgeon, and I've been practicing in Jonesboro for over 25 years. In general, the way that we provide your care is to do whatever diagnostic studies are necessary to determine exactly what's wrong. And then we'll sit down with you and we will tell you what we've determined is wrong, what we see as our options to provide the best care for you possible. And then we'll tell you what our recommendations are based on the current medical literature and based on our experience. People have asked me in the past why I became a heart surgeon. As best I can tell, it's because I seem to have an aptitude for it. I seem to be able to understand the disease process and the treatment that would be best utilized to fix the problem. My father, who had smoked throughout his earlier life and who also developed diabetes later in his life, developed severe symptoms from coronary artery occlusive disease. It got to the point that he simply could not walk much more than 40 or 50 feet without having a little bit of chest pain or some shortness of breath. And I remember very vividly taking him to St. Louis for his birthday and walking from the area in which we parked to the ballpark. We had to stop 3 times because he had some chest pain. And he required coronary bypass surgery in order to not have a heart attack. But after that operation, his entire life changed. He lost about 25 pounds. He was back out in the sun again with his ruddy complexion. He's on his tractor, planted a 100-tree peach orchard. It gave him his life back, and more than that, it gave him 15 more good years of his life. And when I saw that I had the aptitude to be able to do that kind of good in someone's life, I wanted to do that. I carry those images of my father, the way he was, and then the way he became after that surgery with me now. And the best part of my practice now is to have someone back in the office 6 or 8 weeks following coronary bypass surgery or following a valve replacement and telling me that they're a lot better than they were when they started. It's to be standing in the hospital and a patient will walk up and say, "Hey, do you remember me? You operated on me 15 years ago and I'm still doing great." And I get goosebumps anytime. The experience that I have from watching someone go from a situation of being nearly incapacitated because of chest pain to having their life back, that's priceless. You come to NEA Baptist Hospital and let us take care of you.